I have a patient who we diagnosed in collaboration with a scientist from New Zealand, the fourth ever known mutation to cause hepatic fibrinogen storage disease, and so we were able to name that Fibrinogen AI DuPont.
What?
And what it is you get storage of fibrinogen, which almost causes a fingerprint whirl if you look on electron microscopy in these patients. And one could probably draw parallels with this disease with alpha-1 antitrypsin deficiency, where you get storage of the mutant protein in the endoplasmic reticulum. And if your endoplasmic reticulum degradation pathway sort of works well, then you may not become symptomatic ever. Just like patients who are homozygous for the ZZ mutation in alpha-1 antitrypsin, if they have good pathways in terms of their endoplasmic degradation and autophagy, they may not ever present with end-stage liver disease due to alpha-1 antitrypsin. So hepatic fibrinogen storage disease is the same kind of story, but many of these patients will end up with cirrhosis and end-stage liver disease. They usually can be picked up because their prothrombin is usually mildly abnormal, and if you check their fibrinogens, then the fibrinogen activity is very low or absent, and there is no cause for their elevated PT. So most kids who have elevated PTs that I see have significant liver dysfunction. But if their liver function is normal, like their albumins are normal and their clotting studies, their albumins are normal and their bilirubins are normal, then you would expect the PT to be normal. And sometimes you can have vitamin K deficiency for whatever reason. So if that PT doesn't correct with vitamin K, then you're really looking at something in the coagulation pathway. So we investigated that and found out that this child had a very low fibrinogen level. Just observation. I mean, right now my patient is asymptomatic. He's growing very well. He's on the 97th percentile for height and weight, and looks fantastic, but we'll just keep monitoring him for the development of fibrosis. Now that transient elastography is available, we have ARFI to do elastography. We're monitoring sort of as a non-invasive way, the development of fibrosis in his liver. And right now things look pretty good, so.